All right, here we are, another lunchtime live on Monday. What is today? July 19th, 3 days after my birthday. Woo! Got me in here working again. All right, what's up, everybody? I'm Daniel Tribby alongside Dr. C, as she's professionally known. We are the owners of Regenerative Sports Spine and Spa here in the Orlando area. And we do this every week just to bring you guys some extra information, help you make better decisions about your body when it comes to bone, muscle, joint, and spine decisions. So this week we're going to talk about some elbow related stuff. A lot of people, including myself, have problems with elbow tendinitis, and this tends to be something that can last for a very, very long time. So let's break down the elbow a little bit. Doc, what do we see in the elbow majority of the time when it comes to tendinitis?
Usually, typically we call it tennis elbow or golfer's elbow. And so, well, I guess I can do it on me. So tennis elbow is usually on the outside right here. And then golfer's elbow is usually on the inside right here. So it's basically tendons that are attached to the bony prominences there. And so then they can be stretched, micro tears, and then cause a lot of pain. It's like typically it happens on the outside with people who play tennis because of the stress on the elbow, and then same thing with golf on the other side, just because of the stresses of the stroke for those particular sports. But you don't really have to play those sports to actually have these issues. You can still put a lot of stress on these elbow tendons, even with normal daily activities, working out at the gym, all those kind of things. So it's definitely a very common issue that people have.
Right. And what are some of the daily things that tend to be a problem? Like, what do we see a lot of people complain about? Not just the pain, but what on a daily basis seems to cause a problem for them?
It's really just lifting anything. It's like lifting. A lot of people have lifting anything. Like a gallon of milk is too much, and then they have a lot of pain. Sometimes you can even have numbness and tingling. It's like down into the arm and hand. There are some nerves around that area, and if it's inflamed enough, it can affect those as well. So there's a lot of different things, but a lot of lifting type of things are going to be really tough for you if you have that issue.
Right. So you hear the funny bone, you bang your elbow, it's not so funny, but it makes your fingers go numb and tingly. It's because the nerve runs right behind that bony prominence right there on either side where those tendons connect. And so you can get that irritation can cause that numbness and tingling in your hand and fingers. That's not to say it could also be coming from your neck, but we're not here to talk about necks. We're here to talk about elbows. So I've even heard people complain that they can't even write, like to hold a pen, to that pressure to push down even causes pain. Typing on a keyboard, like all those things that are repetitive movements, it doesn't necessarily have to be like, we call it golfer's elbow and tennis elbows because it's where it's commonly seen from just that repetitive racket swinging or that golf club swinging. But it does happen in people who, work with handheld equipment, mechanics, things like that, who are constantly gripping or drilling or using some sort of device, twisting, like that vibration also from those instruments can cause that irritation. Now, typical way we treat this is how? What do most people do when they have this problem?
Typically, we start with, let's say, medications, physical therapy, bracing. So all of those can be helpful for short-term relief, though. And then steroid injections, of course, is one of the first line of treatments that a lot of people do.
And we've talked about steroids being an issue to use in those areas. Give us the quick little 10-second reason as to why steroids for tendinitis can be dangerous versus actually helpful.
So what happens is when you inject these areas with steroids, there's also micro tears there. And so then if you add the steroids to it, it weakens that tendon. And so then what can happen is you can actually have a full separation of the tendon from the bone, and then you have a much bigger issue, so yeah. Yeah,
and steroids actually aren't fixing a problem. They're just taking care of the symptom, which is the pain, right? So then you see a lot of people, they'll wear the little braces around their elbows, right, to give them pressure at other points. Basically, what you're doing is fooling the body at that point to thinking that the attachment point is different, right? That brace doesn't do anything except reduce the stress by just making an extra point of reference here for your body to lose. It takes the stress off the actual bony prominence where the tendon's attached.
Right.
As the therapy guy, I see a lot of people with this from a therapeutic standpoint. We do a lot of stretching, a lot of exercises and things like that, which the research says this is the way to go. the unsexy thing that takes a long time to help you heal is the best way to go, right? And it's that physical therapy. But there are still people who suffer with this for years upon years. I mean, I have a golfer's elbow on both sides. Mine comes from lifting and gripping and exercising and that kind of stuff. And I've had it off and on for how many years now? 2, 3?
Oh, it's been at least 4 or 5.
Right. And it's can be super frustrating because even though you've done all the therapy and tried all the things, you still have pain. And this is not uncommon when it comes to elbow issues. So if all this stuff that you're doing and you still have all this pain, another step that we can take. What makes more sense than using steroids or surgeries, or even if physical therapy doesn't work?
Well, we typically promote regenerative medicine for this type of injury because with like platelet-rich plasma, because it can actually help with those micro tears and get some of that inflammation better, get them healthier, so that it actually gives you a long-term type of repair and relief rather than just temporarily getting the symptoms better and then making the tendon weaker. This can make it stronger. So those are typically the treatments, and we usually recommend 2 to 3 sessions depending on how bad and how long you've had the symptoms.
Got it. And PRP is one of the main ones, right, that we typically use for this area.
Yep.
What is PRP and why use PRP?
So PRP is platelet-rich plasma, and we get it from you. So we would take your blood and spin it down and then get a yellowish substance that has growth factors and anti-inflammatories. And so that's why it can actually help with growth and repair of those areas and get inflammation down so that that tendon is stronger and then the cause of the pain is improved.
Right. So your blood is a plentiful source of healing factors, right? Those of you who've ever taken a basic anatomy class understand that when you get a cut, the blood has special particles, cells, factors, if you will, that help clean the cut and signal repairing of that cut. So the same thing the blood can be used and concentrated and then put back into that area where you're having a lot of pain or micro tears, as you call them, inflammation, tendinitis, and then you're using a very concentrated dose of your body's own natural ability to heal and putting it right where you need it, versus trying to cover it up with a steroid or possibly doing a surgery for something like this. When they do a surgery, how does that surgery actually work? If you're having surgery for golfer's elbow or tennis elbow, what do they actually do?
So they actually detach the tendon and then reattach it and then tie it down essentially back to the bone to stimulate healing, because that stimulates blood flow to the area. And then that's how they try and get this better, is like they're stimulating healing through the blood and reattachment, which, it's like we can now do with platelet-rich plasma or something similar. If we need to, we can always do bone marrow, but that's a little bit maybe of an overkill for this type of treatment. Right. But yeah, so they're doing the same thing, but they're actually cutting and then reattaching.
Right. And if any of you have watched ESPN and heard baseball players talk about their elbow treatment, so they get elbow tendinitis, this is the thing that they use a majority of the time. They're not injecting these guys with steroids anymore because they've realized that the dangers that are present with it. But these guys get into rehab programs. I don't know why that was so hard for me to say. And then they're using PRP injections to help spark this healing portion so it doesn't take them out of the game. So taking you out of the game, speaking of that, how long do these treatments typically take to work? I know you mentioned sometimes you need 2 or 3, but what's the long-term effect here? What are we looking for from a healing perspective?
So typically about 6 weeks, you should start noticing a big difference. Some people start noticing a difference within a couple of weeks of the first treatment, depending on how severe it is, right? So if it's something that has been going on for a long, long time, it may take, 2 to 4 weeks after the second treatment to really notice all the difference. So it does take a little bit of time because you're trying to actually get things better rather than just covering up the symptoms, right? So.
Got it. And if you're just joining us and if you have questions about elbow tendinitis or know somebody that has this problem, tag them in the comments or just wave to us in the comments or even ask your question if you have any. But we've gone through in the first 10 minutes here just kind of about typical problems with elbow tendinitis, how it's usually treated, and why this is not the best way to go about doing things. There's a lot of research coming out now that is showing that a lot of orthopedic surgeries, not just in the elbow, there's not really a big change from a patient perceived outcome, right? So if you're the person having the thing done, the doctor says, oh yeah, it's all better, but you may not actually feel better. And there's a high percentage of people that have the surgery that actually don't get pain relief, versus what we're doing is talking about a very natural way to help spark a natural healing process. Anything else in the elbows, Doc? Anything else that we could talk about when it comes to elbow tendonitis? Are those pretty much the two big issues? Or the only other one I could think of would be like Olecranon Bursitis. You see those people that have the big bubble on the bottom of their elbow, like it's all, you see them in the store, and there's like this big extra. What is that? I've had this before. It's not fun. But what happens there?
Oh, it's just that there's a fluid sac that's in between the bone there. And then so when people actually put a lot of pressure on that, you know, maybe just elbow on the table kind of thing all the time, that kind of stuff. So that just causes swelling. And so that's basically why it looks funny. So it's a lot of swelling in the bursa there. There's a bursal sac.
Yeah, so the bursa sac secretes a fluid or a lubricant that helps kind of keep all your tendons moving freely. Think of them as the oil producers for your car engine, right? So you put oil in your car to keep things lubricated and moving well. If not, your engine gets stuck and it shuts down. Same thing, those little bursa sacs do the same kind of idea. They secrete a fluid that helps keep everything lubricated and moving freely inside the joint and then around specific tendons and muscles and ligaments, those kinds of things. So that is something that I always, when I see people in the grocery store with that, I just I just kind of chuckle because I've had it before and it sucks. And anytime you put your elbow down, it's painful. So what is something that, can we use PRP for this as well? Or is this more of a, let's just wait for the swelling to go down? Like you don't want to rupture that sac and pull that swelling out, do you? Like, how does that work?
So if it's too big and then it does cause a lot of problems, we can drain it, but you know, it's like you don't want to remove it per se. If you do that a couple of times and you're draining it and it still keeps coming back, then yeah, absolutely you can do a PRP and that can help with, it's like that sac not being as inflamed and causing those issues. So yeah, we can definitely use that if it's something that continues to happen, but it's not a typical treatment for that. You can drain it and then hope that it doesn't come back. So.
Got it. All right. Anything else in the elbow tendonitis world that would make sense to talk about on this live?
No, I don't think so. I mean, definitely don't rely on those braces that much. You know, it's like once in a while is fine, but don't wear it all the time because then it kind of fools the body and then ends up, if you stop wearing it, you may actually cause more damage to the tendon. So just be careful with the braces as well.
Right. Very good. Well, if you are in the Central Florida, Greater Orlando area, and you're having issues not being able to play golf or tennis or work out, or just, like you said, pick up a gallon of milk, we would love to be able to help you with your elbow issues. We have a really unique facility here that really caters to natural healing and finding a way to get you well for the long term rather than just a cover up for the short term. So if that's you, we want to be able to help you. Definitely check out our Regenerative Sports Spine and Spa Facebook page. You can link to our website from there, and you can also schedule right from our website. So, or if you just want to call the office and have the personal experience, we can give that to you as well. If you're outside of the Orlando area, we do have some cool VIP packages, if you will. All you have to do is get yourself here. We'll help put you up in a place close by. We get a car and driver to pick you up from the airport, take you to your procedure and all your appointments, and then take you back to your spot and then back to the airport to go home. So if this is something that you want some and desire some help with, we would love to be able to provide that for you. Again, check all the links on our Facebook page and connect with us. And if you're watching this post live and you have questions, comments, concerns, you know somebody who's struggling with this, definitely ask your questions in the comments, tag them in the comments so they can see this. And we'd be happy to go back and answer those questions for you after this live. So thanks to everybody for tuning in and watching. Thanks, Doc, for dropping knowledge like you always do. And we will see you guys next Monday. What's our topic for next Monday? We talked about this morning. What do we got next week?
I think PRP for other orthopedic areas. Yeah.
All right, perfect. We'll see you guys next Monday. Have a great week. Stay safe, stay healthy, and we'll see you guys next time.
All right. Thanks, everybody.
Mm-hmm.